Dr. Layla McCay, who's director at the NHS Confederation. Do you think everything that could be done was done, in your view, Doctor? Good morning.
Good morning. I think that the figures that we are seeing and the words from the Prime Minister are incredibly sad and incredibly frustrating for everyone in the UK, and not least for leaders of the NHS who are working so incredibly hard to manage the consequences of this really incredibly high figure. As to what should be done, what has been done, I think that this is going to be something that people are going to be analysing and talking about for years and years to come. Clearly, lots of actions were taken, and over time, we'll start to understand the impact of those actions. It still feels like it's a bit too close to the coalface to get a full picture of what's going on and why the UK has been so badly affected.
I appreciate this is very difficult to estimate, but they're talking about possibly another 30 or 40,000 deaths. Would that tally with what you can pick up and any experts in the field you might know?
It certainly is very sad to look at the number that we've seen, and we're like, goodness, while the deaths may be about to start coming down, I think that certainly from the NHS perspective, they are expected to come down quite slowly, so we can certainly expect significantly more deaths before we get to a low position in this.
In February, obviously February of last year, Matt Hancock said that the NHS was ready. Obviously, we've seen it was stretched. What does the NHS need to take from this horrific crisis it's confronted?
Well, the NHS came into this crisis from a state of years and years of underinvestment, and really that has been the challenge as we have gone along, particularly in terms of making sure that there are enough staff as the need to look after people with COVID-19, plus all the other...
I think if Mr Hancock were here, Doctor, he'd say that never has much money been spent on the NHS over the last few years.
Well, at the end of the day, there were many thousands of vacancies coming into the pandemic. There are still many thousands of vacancies. In addition to that, we're seeing lots of staff who are off sick due to COVID, due to stress and exhaustion, due to all sorts of other reasons, due to isolation, due to shielding. And that sort of thing makes it really very challenging. As you saw, the NHS has scaled up its capacity hugely over the COVID crisis in order to accommodate more and more and more people. And that has been an incredible effort. In the middle of all that now, of course, we have this new huge vaccine programme that's been delivered so well. And all of that is, it's new activity for the NHS on top of all the demands it already had. So grateful for your time.
I must leave it there only for time reasons. Thank you, Dr. Layla McCay.